Hello, this is me Rekha Sen on Swaswiksha. Today we are going over the traumatic brain injuries. So, what is it? Traumatic brain injuries are the trauma to the skull that resulting in mild to extensive damage to the brain. So, which are these? So, many types of brain injuries are we discuss one by one. The first one is contusion, means bruising type of injury of the brain with slight bleeding of the cerebral vessel at site of impact called COUP. If opposite to site injury will be occur, it called the COUNTERCOUP injury. Contusion may occur with the subdural and epidural hemorrhage. Two type of contusion can be seen. Cerebral contusion, which can be assessed depend on the which area is involved of the cerebrum. Then brainstem contusion result in unresponsiveness. Then concussion is jarring of the brain within the skull. Loss of consciousness may or may not be for less than 5 minutes due to the temporary disruption of the synaptic cavities. Acceleration and deceleration injuries due to the sudden force. So, the acceleration injury occur when the head is fixed but object moves, means immobile head struck on or hit by the moving object. When you are watching cricket in stadium, suddenly the ball is came out and struck on your head. Most common is contusion and seen in male. Deceleration injury, when head moves but object is fixed. Going in the Mercedes with full speed. Unfortunately, cars hit something. Before hit, Mercedes is moving with the CD skull is moving. Same speed within the skull, brain is also moving. In this accident, moving skull hit on the fixed steering wheel of Mercedes. Most common injury is concussion, seen mostly in the females. Then the COUP and COUNTERCOUP, skull fracture. This four type of hemorrhage or hematoma, so it can be classified as primary and the secondary brain injuries. In primary section, from contusion to the skull fracture, and from epidural hemorrhage to intracerebral hemorrhage considered in the secondary brain injury. So we discuss in detail now. So, what is COUP and COUNTERCOUP exactly? If injury happen on the site of the impact, called COUP injury. When object hit on frontally, and injury will be developed on the same surface frontally. And if injury happens on opposite to the site of the impact, called COUNTERCOUP injury, trauma at frontal bone of skull, but injury will be developed on the occipital bone of the skull. But if injury on the both impact site and opposite to that, called COUP and COUNTERCOUP injury.
Skull fracture. It has a four type. The first one is a linear, simple breaking of the bones, and it is the most common skull fracture. Then depressed skull fracture is known as a communicated because fragments of the bone penetrating in the brain tissue. Then diastatic, which is the mostly occur in the young children. Then basilar, which is the most dangerous and severe type of fracture, occurs on the base of the skull. Okay, so understood? If you have any question, ask me in the comment section. Epidural hemorrhage, most serious type, which forms rapidly and result from arterial bleeding between dura mater and skull due to the rupture of meningeal arteries and vein. Dura mater has a two layer. The first is periosteal and the second is meningeal. Both sticking each other, we have a two space, venous dural sinus and potential space. Venous dural sinus physiologically running a venous blood vessels, and potential space pathologically running a meningeal artery and veins. This is anterior cranial fossa and these are the middle cranial fossas, and here it is the posterior cranial fossa with the foramen magnum, and centrally this is the sella turcica. So what is the sella turcica? It is saddle shape depression in body of the sphenoid bone of human skull where pituitary is situated. Most commonly from temporal bone of the skull, trauma has been occur because where meningeal artery running is lacerated or ruptured. Let me tell you, at structure ligament, dura mater tightly held. So blood can't escape from here. So dura mater cannot lift it, which create a well localized hematoma and give shape of the lens and develop tension. Sinus symptoms of this type of epidural hemorrhage, which is in CT scan image, shows the biconcave shape or look like a lens. Epidural hemorrhage frequently associated with the lucid interval also. So the interval is initial trauma. It may or may not be produce unconsciousness. The recovery period normally rapidly. After some hours or days or weeks, patient goes into deeper level of unconsciousness. Epidural hematoma is the surgical emergency. Subdural hemorrhage. Cerebral vein passing through pia mater and from arachnoid mater goes into the venous dural sinus. Dura is more faithful with the bones when pia and arachnoid more sticking with brain. Brain in CSF floating lightly under the dura mater. Due to some reason, position of dura mater and position of brain suddenly shift. This bridging vein will be ruptured. So that's why this vein called bridging veins, which are bridged through this area. So due to the breakdowns or rupture of bridging veins or cerebral vein when approaching the dural sinus. Then these are the deceleration injuries. This type of more common in elderly because with age brain little bit shrink, so brain is more floating freely and chances of these veins are ruptures become less or more. And also in who fail very frequently like a alcoholic and epileptic patient, simple fall can disrupt the relationship. Dura and arachnoid loosely held together, so blood can easily separate and not develop big pressure over here. So it's give a crescent shape of hematoma and it produce sinus symptoms after many days or years of the fall. Initial fall will be forgotten. Then in the CT scan, crescent shape hematoma will be seen and it is not well localized and unexplained fluctuating level of unconsciousness. Then so have to rule out the presence of subdural hemorrhage, especially if patient have a history of fall or patient have been on anticoagulant drugs for longer time and onset of whole problem related to this is very gradual, so called this situation insidious on not sudden onset. Subarachnoid hemorrhage between arachnoid and pia mater in the subarachnoid space due to Barry aneurysm in circle of Wheeler's rupture in 80% cases and other causes which is the arteriovenous malformation will rupture. What is the aneurysm? Aneurysm, it is the abnormal and irreversible dilation of vessels wall. So this is the circle of Wheeler's. From spinal cord, vertebral artery is coming as goes upward, gives branches to the anterior inferior cerebellar artery, then goes upward and convert into the basilar arteries and gives smaller branches to the pons as a pontine arteries, then approach to the interpedicular fossa and gives first branches which is the superior cerebellar artery, then gives supply to the posterior side of the midbrain by posterior cerebellar artery. Then also it is communicated with the intercarotid artery through the posterior communicating artery, then supply middle cranial fossa as a middle cerebral artery and anterior cranial fossa as anterior cerebral artery, and the artery which communicate between the two anterior cerebral artery, it is anterior communicating artery. So the Barry aneurysm occur at a intercarotid artery and rupture. So sinus symptoms are sudden severe headache and increased ICP. How to diagnose these things? By when you do a lumbar puncture, you will find a RBC in that, but take care. ICP node should be raised because raised ICP in lumbar puncture is contraindicated. Intracerebral hemorrhage. If blood vessels going through cerebral substance and bifurcate and make a smaller vessels. Especially patients who have a chronic hypertension, they develop microaneurysm here within the brain substance. Due to hypertension, sometimes microaneurysm rupture called intracerebral hemorrhage, and blood will leak inside the brain. Special features is lead to neurological deficit, means neurological function of that part of the brain will be lost, which suffering by this hemorrhagic events. So in this figure contain all four type of hemorrhage. First one is epidural. In epidural space, hematoma is look like a lens structure. Then second subdural, which is crescent shape in subdural space. Then subarachnoid hemorrhage over here, and the fourth one, it is the intracerebral, which present in the brain substance. Clinical manifestation of the traumatic brain injury. As you can see, the first three pictures are the alarm sign of the traumatic brain injury. In that, the first one is the halo ring, in which CSF is leakage from the nose and ear. So how to confirm that this is the CSF? So we have to collect the sample from the nose and ear by gauze. If yellow ring is present over it, it's called halo sign or halo ring. Then after, raccoon's eye means periorbital ecchymosis. You had seen those fighting movies where hero gives punches to the villain on his face. After that, villain has developed raccoon's eye on their face. So this is the most common in basilar skull fracture. Then third one is the battle sign, where ecchymosis will be on the below the ear. Then other sign which are the present on the fourth figure, which is the decorticate posturing and decelerate posturing. In the decorticate posturing, one or both elbows are flexed and one or both legs are extended. This posture will occur when injury on the cerebral cortex. Then decelerate posturing, that one or both elbows are extended and one or both legs are also extended. In this posture will be occur when injury on the brainstem. So if it is both legs are and elbows are in extending position, so it's posture called decelerate posture. And if it is elbow are flexed but legs are extended, so it is decorticate posturing. So in both case, legs are extended. Then the fifth one, it is the positive Babinski, where when touching the lateral sole of the feet, in that response, toes are extending, which normal in the babies but abnormal in the adult. Sign of increased ICP. The first is papilledema. I will discuss later on that in detail how it will be occur. Then projectile vomiting. In that, GIT center will be disturbed in medulla and vagus nerve is also disturbed, mostly seen in child, but after become adult is normally vomiting. Then due to some reason, cardio inhibitor effect leads to vagus irritated, so heart rate will be decreased, pulse is also decreased, but progressive increasing of BP, specifically systolic pressure. Due to that reason, pulse pressure is widening, because pulse pressure is systolic pressure minus diastolic pressure. So systolic will be increased but diastolic will be not that much increase. So ratio between systolic and diastolic will widening, which is called the widening of pulse pressure. Due to increased BP, blood not goes easily into brain and ischemia will be occur in the brain. Then headache has a special characteristic which unexplained when wake up. As example, when patient is wake up with the headache, but reason don't know that. edema. In this picture, see, from midbrain artery is supplied to the ophthalmic area. This is the structure of eye. This is the optic nerve, and here the vein. CSF is around optic nerve. Why the CNS is around the optic nerve? Because optic is not a nerve, it's a CNS tract which myelinated by oligodendrocyte and covered by the pia, arachnoid and outer dura mater. Normally, pressure in the artery is high and pressure in the vein is low. But when ICP is increased, so further arterial pressure will be increased and vein become compressed by the high pressure. So edema will be occur on the optic disc. So papilla will be developed. And in this, pupil margin are blurred. Management of traumatic brain injuries. Firstly, monitor the respiratory status and maintain the airway because increased carbon dioxide will increase the cerebral edema. So administer oxygen to maintain level more than 90 mf of Hg and maintain the cerebral perfusion pressure more than 70 mf of Hg. Then monitor the Glasgow Coma scale, then vital sign, temperature and intracranial pressure. For the position, elevated the head at 30 degree, also known as the reverse Trendelenburg position or semi-Fowler position, which reduce the venous pressure, but avoid the flat position. Then medications which are as a osmotic diuretics give mannitol 20%, and for which is the increased absorption of the CSF and it is a hypertonic solution. Then if increase CSF production, then give acetazolamide which decrease the CSF and increase the absorption, so ICP will be decreased. Another medication is glycerol. Then provide a cool and non-stimulating environment. Avoid nose blowing, coughing and head movement because it will be increased ICP. Do not clean the ear if drainage is noted, but apply a loose, dry, sterile dressing. Then craniotomy, which is the surgical procedure that involve an incision through the cranium to remove accumulated blood or tumor. So today we had discussed about the traumatic brain injury, which are contusion means bruising type of injury of brain, concussion means jarring of the brain within the skull, and COUP and COUNTERCOUP means if injury on the side of the impact called COUP, but opposite to the side of the impact called COUNTERCOUP, and if it is on both sides, which is the COUP and COUNTERCOUP. In acceleration, head is fixed but object will be moving. In deceleration, object is fixed but head is moving. Then type of skull fracture, which are the linear, depressed, diastatic and basilar, which is the most dangerous. Epidural hemorrhage, in which meningeal artery rupture or lacerated in potential space and develop localized hematoma which has a lens-like a shape, and this is also a surgical emergency. Subdural hemorrhage, bridging veins rupture which approaching the dural venous sinus and subdural space create a crescent-shaped hematoma. Then subarachnoid space occur mostly due to the rupture of berry aneurysm, and RBC will be present in the CSF which called xanthochromia. Intracerebral hemorrhage occur in the brain substance due to the microaneurysm rupture who have a chronic hypertension. Then sign and symptoms: halo sign, raccoon's eye, battle sign, decorticate posture, decerebrate posture, positive Babinski sign and sign of the increased ICP. And for the management purpose, we have to do the 30-degree position to the patient, and as a medication we will give the mannitol, acetazolamide or glycerol, and if can't manage by doing all these things, then craniotomy. Okay, so this video over the traumatic brain injury. So thanks for watching. Don't forget to subscribe our channel for more videos and share to your friends. It must be helpful in this quarantine time.